All right. Good evening, ladies and gentlemen, visiting us here for the second of Botetourt County's community education sessions. So I am Cody Sexton, the assistant to the county administrator and your MC for this evening. And once again, welcome to everyone who's joining us through Facebook Live or through any other medium coming at us or watching it at home after the fact. Uh, we are happy to have with us tonight some folks from Blue Ridge Behavioral Health, and on behalf of the Board of Supervisors of Botetourt County, we look forward to this event and welcome you all. So without further ado, I'd like to introduce tonight's topic. The COVID-19 pandemic and the important measures to reduce the spread of infection have also made it a challenging time for everyone's stress levels and mental health. All of us have been asked to change our normal routines, sometimes in very dramatic ways. Find new ways to connect with our loved ones, stay home for long periods of time, or just among many other day-to-day changes that have come to our lives. So tonight, we will have a presentation from experts at Blue Ridge Behavioral Healthcare about the impact of the COVID-19 pandemic on mental health and well-being. You'll learn about what you can do to help promote good mental health during these challenging times of the pandemic, prevent more serious problems from occurring, and what to do if you or a loved one begins experiencing more significant problems. We hope to provide helpful information to Botetourt County residents and residents of any locality who's watching that helps them navigate the stress they or loved ones may be feeling during all these changing times. So tonight, I'd like to turn it over to Ms. Debbie Bonnewell. Debbie Bonnewell has served as the Chief Executive Officer of Blue Ridge Behavioral Healthcare since 2014. Blue Ridge Behavioral Healthcare serves over 8,300 people annually that are residents of Botetourt County, the cities of Roanoke and Salem, Roanoke County, and Craig County as the Community Services Board or Public Mental Health Agency for these 5 localities. Debbie has served in direct clinical service roles as well as management and leadership positions in public behavioral health and human service agencies for more than 22 years, primarily in Virginia's Community Services Board system. She holds both a master's degree in business administration and a master's in social work, both from the University of Texas at Austin. She has been licensed as a licensed clinical social worker in Virginia since 1997. Early in her career, Debbie provided inpatient and outpatient individual and family therapy for children, adults, and families with mental health illness and substance use disorders. She feels very fortunate to have landed and to currently serve the needs of people with mental illness, addiction, and developmental abilities in the beautiful Roanoke Valley of Virginia. Debbie and several experts from Blue Ridge Behavioral Healthcare are here with us tonight for the benefit of Botetourt County residents and to talk about the impacts of COVID-19 on mental health. So with that, I turn it over to Debbie, and she will kick us off tonight and then also introduce the other folks she has with us. So thank you, Debbie.
Well, thank you, Cody. I just want to express my appreciation to the Botetourt County Board of Supervisors and the Botetourt County Administrator's Office for the invitation for us to be here to talk about this important topic. We appreciate your wanting to educate your county residents and those of the Roanoke Valley about mental health. We appreciate the opportunity. So let's see if I can make my slide advance. Actually, Cody covered the introduction of who Blue Ridge Behavioral Healthcare is and who we serve. We've proudly served the Roanoke Valley, including Botetourt County, for over 50 years. Tonight, you'll hear brief comments from me, but then you'll hear from our real clinical expert, Tamara Starnes, and our prevention and wellness expert, Sheila Lithgow, who I'll introduce in just a minute. As Cody mentioned, the whole pandemic, of course, has been very stressful for everyone. And some of the safety measures that have and recommendations that have come out for us to stay safe and to stop the spread of COVID-19 have certainly created a lot of byproducts in all of our lives. And I think probably one of the main things that I try to say to everyone is that it's really okay to not be okay right now. We literally have disrupted our entire normal routines in one way or another. And so there's many people that are either mildly or moderately struggling or even more so. And there's a lot of things that could be byproducts of this, including complicated grief if somebody's lost a loved one and wasn't able to be there with them. Some people are feeling isolated or less connected, even though we have all these, new technologies. It's, for some people that's not the same. As I mentioned, all of our normal routines and schedules are different. That's stressful for anyone. And for some people, there's a major disruption to their work life. Either those who have gone from an office or a place to working from home, or for those who have lost their jobs. We know that those things are very stressful and can lead to other problems for folks later on. And then of course, fear about the illness itself and all of the unknown factors. We've got great health experts at national levels trying to figure out the disease, and there's so much that's unknown that those things create a lot of fear and uncertainty. And as with any major disaster, trauma is always a byproduct for those who go through it. And I don't want to say too much more, except to turn it over to Tamara at this point. And let me introduce Tamara. Tamara Starnes has served as the Chief Clinical Officer at Blue Ridge Behavioral Healthcare in the Roanoke Valley since 2016. Tamara is licensed as a professional counselor in Virginia, South Carolina, and Georgia. We have 3 for 1 with Tamara. Her professional awards include the 2011 NAMI Mental Health Professional of the Year, awarded by the South Carolina National Alliance on Mental Illness. She is a certified public manager, and her most extensive areas of knowledge that we've actually benefited from greatly at Blue Ridge and in the area include justice and mental health collaborations and evidence-based trauma treatment. So without further ado, I will turn it over to our mental health substance use disorder expert, Tamara Starnes.
Thank you, Debbie. I appreciate it. And thanks for letting us be here. I'm just going to build a little bit more on what Debbie's sort of introduced us to already. And it's really this idea of there are multiple factors happening right now, multiple stressors for people as a result of COVID-19. And as those things come together and sort of build on each other, depending on what a circumstance might be, that weight just kind of really sticks around and becomes this sort of prolonged chronic stress event. So, some of the things we've mentioned already are health concerns. So a lot of people worry, will I get sick? If I get sick, how sick will I be? I think we've seen a really wide range from people being asymptomatic with the virus and all the way to unfortunately passing away from the virus. So there's just this big unknown of if we do get it, how's that going to affect me personally? There's also concerns about family and friends. Will they get sick? If I do have a family member that may be older that I've been taking care of, how do I take care of them now? Can I still see them? How do we help, friends and family that may get sick, get groceries or, and then just worrying about them in general. Will they make it through the illness? We've also seen folks that it looks like maybe are scared to get medical care. And that's been something we've heard more about in the news in the last month or so is there seems to be some lower numbers of people visiting emergency rooms. And we see that at our clinic as well. I'll give you a few numbers about that later on, but there's a worry about even going out in public or into a public building and seeking help when you do need it. A little bit about economic impacts. We've got folks that maybe have job loss or even reduced hours at work. So some people might still be working, but they're underemployed at the moment, or they're on a furlough. So the increased stress of the economic impacts on top of, all the health worries. So you can see how this is starting to build. Just some of the measures we've had to put in place as a state, as a society, to help slow the spread of the pandemic can also have effects. So, there are a lot of people that have been able to keep jobs and they may be working from home, but that may be different for them. If there's someone that really appreciates and enjoys being around other people and they get a lot of comfort and energy from that, and now they're at home feeling more isolated even during the workday, that can have some impacts. And we've also seen the big changes in people who might have to homeschool. And so right now we're in the summer for most people, but we've got an upcoming school year to think about, and how's that going to work? And I had a friend who worked from home doing telehealth and also had 3 kids in the home that needed schooling during the last school year. So it's like just all these things overwhelm me. How do I do both these things at the same time? There's literally not enough hours in the day. And then just changes in routine in general. So one of the things I think mental health folks like to educate on is any change can be stressful. That can be a good change, that can be a bad change, whether you want it or it's exciting, it's still different. And there's something about being human that we like things to stay the same. So when we have disruptions in our routines, it really does affect us. So if, for example, a lot of people have really good coping skills, and like maybe visiting with friends once a week or going to church or, being around family members, and those things we've had to find ways to do those things differently. So even for people that had or do have some good coping mechanisms in general, those have been different in trying to problem solve. How do we still stay connected? Also has an impact. So we can go to the next slide. Thank you. So again, all those things on that list that we've talked about so far really kind of meld into this increased isolation. Any way you sort of slice it, the pandemic's really made us more isolated as a community. And that's where I think most of the impacts start to hit physically, mental health wise, substance use wise. That's really sort of the crux of what can sort of exacerbate somebody that might have some mental health symptoms to start with, or some substance use things to start with, just that isolation and loneliness. So I had gotten the pleasure of seeing a former Surgeon General of ours, of the United States former Surgeon General Vivek Murthy, speak at a conference. And he just really had this platform that he talked about loneliness being truly a public health crisis and an epidemic in America. And, some of his things that we heard him say a few years ago are even more prevalent now. So if you think about loneliness being a health crisis years ago, gosh, think what it is now in a pandemic where we're kind of forced to be more separate from each other. So one of his quotes here you may see on the slide is, the problem is when loneliness persists for a long period of time. And when it's chronic, then we enter into a chronic stress state. And that is what has dramatically consequential impacts on our health. So again, we've got kind of this ball rolling. We've got increased stressors. We've got coping skills kind of being taken away, and we've got increased isolation. So for anyone, that can be, hard to deal with. So I think that's one thing, like when Debbie said, it's okay to not be okay right now. It's a pretty normal reaction to a very abnormal state of how we're dealing with the pandemic right now, just around the country. So I think a lot of people are going through that same thing. So one thing to take away is, if you're feeling, more depressed or anxious or stressed, I think you're not alone in that. We do know that chronic prolonged stress contributes to increased depression, anxiety, and health problems and substance use. So that's just typical on a normal day. So we know that, and I think we definitely see that in the community right now. Blue Ridge Behavioral Healthcare, we had, when the pandemic started, about a 25% decrease in emergency services. We also had about half the number of people coming in on a daily basis to get a new case open for seeking help. And while that seems like, gosh, that might be a positive just from the numbers, what we really have taken from that is that we know that folks are still suffering. We know that folks are having impacts. And our fear is, and I believe the numbers speak to it, is that there's probably a good portion of the population that does need help and again is not seeking the help right now. Based on those things like we talked about already, fear of seeking help, maybe feeling uncomfortable to go in somewhere to get help. We've also seen across the region a real increase in overdoses. So that's been really concerning to us. And we've seen that in Roanoke City, Roanoke County, also here in Botetourt County. When we look at some of those numbers and we look at last year, 2019, there were about 16 total overdoses that were recorded, and 3 of those were fatal. And so far this year in 2020, there have been 12 overdoses with 3 fatal. So you can kind of see from those numbers that that's a significant uptick considering we're just getting to halfway through the year. So that's our concern, is that, all these factors together, all the increased stressors are really sort of melding for some folks to create a crisis situation. And there are several folks in crisis that aren't reaching out. So our biggest hope is that if you're listening and you're having issues and need to reach out, that's okay. Please do that. If you know of other people that do or have friends and family members, please encourage them to do that. And we'll talk a little bit more about some resources further down in the presentation. For most people, like I talked about, it's pretty normal to feel some increased stress and anxiety right now. Most folks can cope with that by trying to build some resilience, and you'll hear a little bit more about that later. Finding ways to do new coping skills or adjust the coping skills you had before. So I've heard people do things like Facebook game nights, so where they used to maybe meet friends in person to have a game night, they turn their computers on and they do it over a Zoom app or a FaceTime or something like that. Some people, if you can't go into a gym right now or don't feel comfortable going into a gym right now, getting out and just walking, in your neighborhood if it's a safe place to do that. Utilizing social supports. I think that's probably one of the biggest things we can do for ourselves right now is, reach out to friends, reach out to family. If there's someone you haven't talked to in a while, right now is a great time to do that. You have a natural topic starter, which is, hey, what do you think about the COVID virus right now? So reach out and talk to folks. And there's also some really powerful practices like being grateful for what you do have. So practicing gratitude helps a lot of people. And what that means in real life is, at the end of the day, write down 1 or 2 things that you're grateful for. Even if it's small, even if it's, I just woke up today. That's okay. And really also write down why you're grateful for it. There's something about writing down what you're grateful for and why that really makes it stick in our brain and our physiology and helps people kind of focus more on the positives, the things they can have control over versus some of the negatives. So practicing gratitude is really helpful for folks. And anything you can do to help other people. We definitely know that giving is often, you get more from giving than receiving. And if you're a giver and you've done that, you hear that over and over. So anything you can do to reach out to a neighbor or, anywhere you can give back a little bit helps. So that's for a lot of people, can cope that way. There are some times, however, that those things don't work or you're not getting as much relief as you feel like you need to. So then it's like, the question becomes, when do I know that I need help? So we've got the next pieces divided up in a couple ways. One is talking about mental health mostly first, and the second one's talking about substance use. I will say that most people who have some substance use also probably have some mental health things going on, and there's a really high rate of co-occurring disorders for mental health folks that use substances. So a lot of times those things come hand in hand. And a lot of times, if one kind of starts to exacerbate, the other one will increase as well. So it's one of those circles. So you'll hear a little bit of overlap here, but I'll just go through a few things to consider when you're sort of questioning, where am I at? Am I at the point I might need to reach out for some professional care, something a little bit more structured. So one is if symptoms start lasting for a longer period of time, for several weeks, and they're affecting like relationships, work, family. So that's really, for us in the mental health world, the defining factor about, do I need help? Do I not need help? Is if this is affecting your life in significant ways. Again, relationships, family, work. Also, you may want to look for changes. So again, changes are something that we look for, changes in appetite, energy level, sleep patterns, weight. So sometimes those things can go up, sometimes those things can go down, but for most people, what we're looking for is something different happening. Another key to look for is increased like irritability. Sometimes being depressed or anxious can come across as being irritable and like having low frustration tolerance, increased crying spells, feeling fearful or on edge a lot, really severe sadness. Those things are something you might want to consider. And lastly, just not finding enjoyment in things you used to and withdrawing even more from others. So those are a few of the mental health signs I would say to look for. And if you're experiencing those and it's lasting several weeks, it may be time to reach out for a little bit more care. And we can go to the next slide. Thank you. So substance use. Again, remember these two things kind of go hand in hand. Substance use may affect your depression levels, for example. Your depression levels may affect how much you're drinking. So a lot of these things are intertwined and hard to kind of peel apart. But when we look at substance use, we're really looking at, when someone starts to use more substances than typical for them. That may be a sign that you need to start looking for some professional help. Also, not being able to stop using even though you want to, that's a big indicator. So if you find yourself or someone that has the desire to stop or use less and they're really having difficulty doing that on their own, that can be a time to reach out. Another clue may be that if someone is trying to decrease their use and they start having like really urges to use and cravings to use, those to us are some signs of actually substance use moving into the addiction level as well. So if you're having cravings or urgings to use, it might be time to reach out. Another criteria is when someone may be spending a significant amount of time trying to obtain and use substances. So it's taking up a lot of your life, more time than you really want it to. Also, a big one is using even when you know it's causing you harm. So some folks kind of know and maybe have some insight into this isn't good for me. This is affecting things in my life. And so when you start seeing those sort of negative effects at work or home or school, but you continue to use, that may be a sign that it's, some use has gone over to the abuse side. When you're building a tolerance and need more of the substance to produce the intended effects, so you need more of that substance to feel the same way you initially felt or wanted to feel, can be a clue. And then also, if you're experiencing withdrawal symptoms when you try to stop or do decrease use. So some kind of subtle sort of withdrawal effects can be like irritability and trouble sleeping, headaches, hand tremors. So a lot of times people, they don't really make the connection that, hey, I'm feeling irritable and can't sleep because I've just tried to reduce my substance use. So those things do happen sometimes for folks when they start to withdraw. So we can move to the next slide. So we've talked a little bit about mental health, when that might be a time to get some professional help, some signs for that, and also substance use, when might be some things to look out for. I really wanted to touch on as well a little bit more on what might be a more emergent situation. So there are some things you may be able to handle just on your own. Sometimes you may need to reach out for professional help. And then there are some things that really are more emergent type situations where you want to get to a hospital or help someone else get to a hospital, or perhaps even a detox facility. So anytime someone has suicidal thoughts with a plan or intent, that's probably a good time to get some emergent care. Also on that list is homicidal thoughts. And a third big one is when a person's unable to care for themselves due to significance of symptoms. So a lot of people, know that, hey, if someone's suicidal or homicidal, I probably need to get them to a hospital. Some people miss this third part, though, about if a person's not able to care for themselves. So that's really some examples of that might be the person that stopped eating, or the person that stopped drinking water, or someone that maybe is wandering the street, or isn't able to get out of bed to bathe for a long period of time. So some of those may be signs that the person is so symptomatic they're not able to care for themselves at the moment. Also, any new psychotic symptoms. And we really put new psychotic and symptoms in there just because some folks at a baseline may have that even on medication and they may be okay. But if new psychotic symptoms are starting, that may be something to get checked out. Also, when overdose is expected, and when experiencing life-threatening effects of substances or withdrawal. So those are kind of related. Sometimes you may see people with trouble breathing, changes in consciousness, chest pain, seizures, all those types of things, even in withdrawal, can be life-threatening for some folks. So if you see those emergent things, we want you to really help people or yourself get that emergent care. So again, just as a recap, there are resources that can help. We'll give you a bit more on the services we have and numbers you can call at Blue Ridge towards the end of the slides. But there are lots of things that can be done. There's emergent care, there's substance use treatment, there's mental health treatment. There are hotlines and warm lines out there if you just need a little support or want to ask more questions and how to get support. If you're struggling with substance use and are really like 12-step type meetings, they have those online right now. Also using natural social supports and helping others. So again, another quote from that former Surgeon General I really like. He said, "It turns out that when we reach out and help someone else, that not only enables us to connect with other human beings, but it reminds us of our value and of our purpose in life." So that's really kind of one of the takeaways is we want to be helpers to each other as much as we can and support each other when we're going through things like COVID-19. Thank you, Debbie. I'll send that back your way.
Okie doke. Meredith highlighted some of the very important things to be aware of for mental health and substance use disorders. And so now we want to turn to some of our more prevention and wellness kinds of information. And for our next speaker, we are fortunate to have Sheila Lithgow, whose role at Blue Ridge Behavioral Healthcare is as prevention and wellness specialist. In her position within our small but mighty prevention and wellness division at Blue Ridge, she additionally serves in the roles of both facilitator of the Suicide Prevention Council of Roanoke Valley and the facilitator of the Botetourt Prevention Coalition, specific right here in Botetourt County. In addition, Sheila is a Botetourt County resident of over 20 years and has raised her children right here in Botetourt County. And so without further ado, I will turn it right over to Sheila and just let me read a slide.
Okay, thank you so much, Debbie. Thank you to Botetourt County for hosting this. So one of the things that Tamara talked about is building resiliency, and that's the ability to bounce back during and after experiencing difficult times. Resiliency can be taught, learned, and expanded for everyone. It's that mental reserve of strength that people are able to call on in times of need to carry them through without falling apart. So, we're dealing with a lot of change right now, like Tamara was talking about, a lot of uncertainty with COVID. And we know that dealing with change and loss is an inevitable part of life. And at some point, we're going to all experience varying degrees of it. Some may be very minor, like we fail a class or we have a breakup, but then others are at much larger scales, like what we're experiencing now with COVID, child abuse, trauma, natural disasters, and things like that. So how we deal with these problems can really play a significant role in not only the outcome, but also the long-term psychological consequences. So it's important to think about, what has helped us overcome things in the past? What coping skills, healthy coping skills have we relied on in those tough times, those things that we've gone through before to help us feel okay? So really building from those strengths that we have. And also instilling hope, and Tamara talked about or mentioned that as well. Hope is the belief that things are going to work out, even when it seems otherwise. Really things are really uncertain right now, but hope helps us believe that we can get through it and helps us remember the times that we did make it through. And again, recalling those important coping skills that's helped us in the past. Okay, next slide. So to build on the resiliency, when we talk about building that resilient shield, we talk about different categories. And one of the first ones is building resiliency within ourselves. So it's important to value ourselves so that we can value others. So being able to have the self-control and recognize our own emotions to make it easier to express our feelings to others. And ask for help when we need it. That's a really important piece, I think, right now, is being able to reach out to our support systems and ask for help. Because once we have support from others, we feel comfortable with our emotions. It's easier to be optimistic about the outlook on life. Family, that's really important. And it doesn't have to look a certain way. Families defined by the people who support you and who have your back. Maybe it's not always blood related, but it's important to have that network of people that you trust and you feel safe enough to ask for support and who's going to celebrate you and your accomplishments. Friends, that's just as important like family. And I'm not necessarily talking about the 300 or 400 people we have on Facebook, but it's those friends that you can call at 2 o'clock in the morning and say, hey, I need your help. And they're going to come. They're going to not ask any questions, but they're going to be there for you. And that's the type of friends that we're talking about. So just like family, it's important to feel safe with your friends and have a mutual trust. So that's going to help build resiliency. School, that, we know our youth are spending a lot of their time in schools. We're not exactly sure what that's going to look like once school starts back with everything going on. But we know to build resiliency for our youth, it's important to have school staff, to have parents and guardians and community members that are going to help our kids feel safe in school and have those extra supports that they're going to need to help them through the day. So, maybe we didn't have the best experience in school growing up, but it's important to make sure we encourage our kids to excel and do well and be involved in school and get involved in things that can help build their resiliency. Work, we spend a big portion of our lives at work. We spend it with coworkers and supervisors, and it's really important to build, help have good supportive relationships at work to build that resiliency. You have coworkers that you could go to talk about things and have that sense of belonging to help, build support. And talk to someone if you're struggling with something, you've got that network. And then of course, community is very important. We devote a lot of our time in our communities out with groups or, in our neighborhoods or at our faith-based programs or our clubs, just whatever community is to you. That gives us a sense of purpose and belonging, and it's also a way to gain support. So the community resource here, this is through the Roanoke Prevention Alliance Resiliency Collective, and it's just a small step of a presentation that is available to community members. And I'm going to ask Cody if he can put in the RASAC director's email there. It's Lexi Johnson at Blue Ridge Behavioral, BRBH.org. We actually have another session coming up July 16th if you want more information about how to build resiliency within yourself and the community. It's a 1 hour free session that is available that you can email Lexi and get signed up for that. It's a really good presentation, gives you some more information. Okay, next slide, please. Thank you. One of the difficult things to talk about, but very crucial to prevention, is suicide. And Tamara mentioned this in her part, that we know it's the 10th leading cause of death in the United States, and it affects individuals, families, and communities everywhere. It impacts us all. And we know it's a complex health issue, and we also know it's preventable. So there's a lot of resources for individuals if they're having thoughts of suicide or struggling in any way. And there's a lot of resources to educate everyone and ourselves about ways to help someone. So our Region 3 East Suicide Prevention Collaborative, we just launched a website called AskingSaves.org. And Cody, if you could put that in the chat box as well. That gives you some resources about suicide prevention in our area. It gives you some information about trainings that are available that can help teach you how to talk to someone if they're struggling. And then we also have some national numbers that I feel it's important for everybody to have in their cell phones. The National Suicide Prevention Lifeline, that's a 24/7, 365-day 1-800 number you can call. You're going to reach trained professionals, counselors that can talk with you. So again, it's important to have that number in there in your phone. Also, there's a crisis text line if you feel more comfortable texting instead of calling. You can also reach a trained counselor when you text hello to 741-741. And then also for our veterans, there's a crisis line through the Lifeline. Once you enter that number and you press 1, you've got those resources as well. So if Cody, if you'll put those numbers into the chat box for people, and again, just stress the importance of having those things in your phone. And then, like Debbie mentioned, the Suicide Prevention Council of the Roanoke Valley, it's a group of professionals, community members, and partners with a goal of reducing suicide in our area. So we're really working collaboratively to educate others in the area about suicide prevention, behavioral health, and wellness. And we want to encourage people to seek help when they're struggling and raise awareness about mental health supports and resources, and make it okay to talk about mental health, just like we talk about physical health, being comfortable talking about mental health, and breaking down stigma that's surrounding that. And our council, we welcome any community members that would like to join us. We service the whole Roanoke Valley, so you can also find us on Facebook. All right, next slide, please. Just some other resources that are offered by Blue Ridge Behavioral Health Care. We have a Talk Saves Lives, and that's a free 1 hour presentation about suicide prevention, just a basic introduction to what we know about suicide, the most up-to-date research on prevention, and what we can do to fight suicide. So participants will learn some common risk factors for suicide, how to spot warning signs in others, and how to help ourselves, but also help loved ones that we know might be struggling and those in the community. So we have a session coming up next Tuesday from 2 to 3 that you can register with us at Prevention. We'll send you the link once we get you registered, but I know we have more space for that, so if you'd like to participate in that. We also have a program, this is a national program called Mental Health First Aid, and we're hoping to start providing these trainings virtually in July. There's an adult version, and then there's a youth version. If you work with youth, it's a really good course for that. So it's a 1-day course. It's going to teach you how to identify, understand, and respond to signs and symptoms of mental illnesses and substance use disorders, and give you the skills to reach out and provide that initial help, just like we do with first aid and CPR. you know, what are those first initial steps we need to get someone help? These are the first initial steps you can help someone who might be in crisis, or they're just struggling with a mental health or substance use disorder or a problem. So again, we have some of those that hopefully will be coming up virtually starting next month. And then we also have a 2-hour training called Understanding Adverse Childhood Experiences. And this focuses on brain development and the effects of trauma on an individual as well as population health. And again, how we can build a resilient community. So any of these services, you can contact our prevention department through Blue Ridge Behavioral Healthcare to learn more about these programs. So, and last but not least is the importance of self-care. I know we see a lot of information about self-care, and that's really just taking care of ourselves physically, emotionally, mentally, spiritually. We're not just talking about, you know, taking a bubble bath, but, you know, really taking care of ourselves physically with sleep, exercise, you know, taking breaks, eating healthy, taking care of our emotional stress management, showing compassion and kindness. And I think it goes back to what Tamara was saying about gratitude and being thankful for what we have. Our social boundaries, building on our positive support systems, kind of limiting our social media. We see that a lot, you know, looking at positive social media. Sometimes we can get too overwhelmed with so much out there, especially surrounding COVID. So it's important to, you know, minimize that and take breaks from social media. Communication, of course, is utmost importance, and reaching out and talking with people and reaching out to somebody that you might be concerned about, and especially asking for help. And then also our spiritual, you know, doing things that are good for our soul and getting connected to what you feel is spiritual for you. So, all right, I'm turning it back over to Debbie.
Okay, and I just wanted to wrap up with just a couple of little bit of information about how you can contact Blue Ridge if you should want to seek services with us. Our website at www.brbh.org. And just to point out that once you get to the homepage of the website, you'll see on the screen, there's a little yellow tab that we added, I think about mid-March, that if you click through has a number of COVID-19 resources, including some of the links to the AANA online meetings that Tamara mentioned. It includes some specific resources for mental health, substance use disorders, child and family resources, as well as some of the prevention resources that and links that Sheila just mentioned in numbers. So that's easily available to you if for some reason you lose it in your Facebook page. The other thing I wanted to mention is that at Blue Ridge, pretty quickly in March, our regulatory bodies at both the federal and the state level gave permission for us to deliver behavioral health care services in a telehealth format. We pretty much transferred our services within about 2 weeks from office-based to telehealth, which was a mighty effort among all kinds of folks at Blue Ridge, both our support staff, our clinical staff, our prevention staff. And so many of our services are available that way, either telephonically or via virtual kinds of technologies. However, we are still open with our same-day access center at the Burrell Center in Roanoke. I'll give you that address in just a minute. I know one of the things that is on my mind when I go out and about in the community is I want to know what safety precautions a business is taking. And just to outline a couple of those things, we encourage people who are sick to stay home, both clients and staff. And then there's a couple of rules that we kind of have. If you've had a fever in the last 24 hours or other symptoms of COVID, or have had contact with a confirmed case, we ask you to please call us before coming to our office. The phone numbers that you see there are also on our website and will also be on the next slide. If you are coming to any of our office buildings, we ask that you please wear a mask if you have one while inside any of our buildings. Our staff will be wearing them as well. We ask that folks practice the 6-foot physical distancing with all other people while in our buildings. We are also, so that you're not surprised, screening at the front door of all of our open buildings, asking screening questions for symptoms of COVID-19 and taking temperatures. And finally, almost finally, our BRBH staff are asked to check their own temperatures and self-screen daily for symptoms before they come to work. And they are encouraged to stay home if they're sick or have had close contact with someone with a confirmed case. But again, it's not necessary that you come to our building. Online or telephone options are continue to be available as long as we have that regulatory approval. We are trying to educate some of our oversight agencies that we think that those regulatory barriers should be removed for at least throughout the pandemic, if not forever. Some of us think that probably a move to have telebehavioral health as at least an option for those that can benefit from it is probably 10 years, if not more, overdue. And just finally, we're open. And those are all of the numbers. That little screen kind of pops up when you first go to our website. Our same-day access center is there at the Burrell Center at 611 McDowell Avenue, Northwest Roanoke. Same-day access is available Monday through Friday, 8:30 to 3. You can call to start those services at the 540-343-3007 number. And as Tamara mentioned, emergency services, we also offer 24-hour crisis services at the 540-981-9351 line. You do not have to remember these. You can always go to our website and find those. So we say this, we're not the only provider. Certainly you can seek help with your family doctor. There's other providers as well. But I think the message that we want to get out is if there are people out there that need help, to please reach out and get some help. And that really concludes our presentation, and we're happy to have further discussion or take questions. And so I'll turn it back to Cody.
Well, thank you all for that information. I know I learned a lot. My brother, full disclosure, is actually an employee of Blue Ridge Behavioral Health Care. So I hear a lot about your services on a regular basis. And I know it's a huge benefit to the community. So one of the things that I've been looking at, we don't have any questions that came in during the presentation, but one that came to my mind early on, and this was Debbie, you mentioned something about funerals in your presentation. And as we know, the springtime is a time of lots of rituals. So not only funerals, which sort of pop up, but often lots of weddings, graduations, all of these transitions in life, if you will, and we've not been able to celebrate those.
Right.
And that's added a level of complexity to the mental health picture, because I think what we see is perhaps a lot of regret over those, and that compiles onto that. So for folks sort of dealing with maybe this, I don't want to call it a sense of aimlessness, so not quite to a level of sort of needing professional services, but just ones who just are at a loss for how to feel during this. What do you all recommend?
So I will see if Tamara and Sheila want to answer first.
Yeah, I certainly feel for those folks. I think I have some family members that have just graduated college or, those kind of things. And there weren't the big celebrations graduating high school. And there's still some celebrations, but still it feels different, and it is different. So I think it goes back to that part about, we're in it together. We all kind of realize that that's a bummer. Part of it is trying to keep your eye on the long term. So, missing a ritual today can be a bit disheartening if you've really put a lot of time and effort and years, sometimes even to to accomplishing a goal, and then it doesn't get as celebrated as you feel like it should, and it's anticlimactic. I think remembering again, even going back to some of that gratitude practice of, what can I say? What can I accomplish? How can I celebrate my own win? Can I even postpone a celebration till later? There have been even, within our own agency, people retiring that have been with us for over 40 years, and you want to have this big celebration, but you're limited right now. So we're putting that out, we're putting that months out and hoping to still do it. So some of that may help, just putting it out, talking to other people. I say talking is the best medicine, just voicing your disappointments and being validated a bit for that. And then, after kind of some validation and really feeling it, trying to turn a little bit more to moving forward and focusing on that positive long-term kind of reward.
Oh, and I was going to say, just being creative with, still being able to celebrate, but you have to get really creative. Like we've seen, if you look on Facebook, there's all kinds of things people are doing to still celebrate, but we're doing it differently, drive-by baby showers or wedding showers, or having that prom with your dad in the backyard. So, just being creative and doing things a little different and still making those special memories. So.
And that, just to piggyback on that, one of the things that really hit me the other day was when we were kind of talking about some resiliency topics, and Sheila mentioned it, that you think about the times in your life that you've lived through tough times and overcome them and found an inner strength and maybe learned more about yourself in the process. It can be helpful to remember those times. And then, if you start applying some of that inner strength that you might find there to this situation, and really, as Sheila mentions, unleash your creativity. Like people that have those, on the positive celebrations, people that have those during this time, they're going to have a story like nobody's ever had in 10 years to tell kids or grandkids, and they're going to have a very unique story to tell. And so, if you can reframe it into a positive that way, that's just one way that I think of to try to think about these times.
Well, thank you for that. I know I've participated in a drive-by birthday party during this time, so it's definitely been creative. But I think it speaks to that part of, this is how we connect to our community and some of the things that we rely on to help us through the difficult times, or to have a sense of achievement. So that's a huge piece. Getting sort of in that topic, and I don't want to belabor the point or hold up too much time. One of the things that we've heard, a lot of new terms thrown around. New normal is the one that probably rises to the highest of the list. And what we hear, especially from folks in our workforce or at other localities, is that some people, they really just want to return to how it was. It gets to what you were saying, that we want to return to the routines and to everything that we know. But yet the world seems to be showing us that could be a very long time off, especially some of the reports we're seeing come through here. So what does a new normal for mental health care look like during this time? Is it simply at a distance, or how are y'all parsing through that, and what plans maybe do you have for a longer future in this state?
I would say, and Tamara, you can jump in too whenever you want to, but we talk about that quite a bit. The problem is that we're right smack dab in the middle of living it, and so we do try to keep a pulse on. There are some clients that do very well and actually are more engaged via the telehealth kind of venue. there's some clients that probably struggle a little bit more. And I know that Tamara keeps like close eye on that with her staff and is talking to them about how do we outreach to them? You know, do we need to go out and visit them and maintain the 6-foot distance? Is that going to be beneficial for them? So I think that I think that exactly what we just talked about in terms of being creative and kind of living into kind of these new ideas is something that I think we and probably every industry, every business is also looking at. Any other comments from Tamara or Sheila about that?
Yeah, I completely agree with you. I think we're right in the middle of it. So we're doing at the moment what we need to do. But I think there is, our hope is that we get to keep the best parts of how we're delivering services right now and eventually meld them with how we have done it in the past. So that is kind of our new normal that we're hoping to have further down the road. I think part of the hard part is the unpredictability. When will that be? People want to know. When we first got into this, we thought, oh, this will pass in 3 months, right? We'll be on the other side of it. Everything will be back to normal. And it is a longer response. And we just know it's going to continue to be that way. So I think people are trying to be creative. You think about having a 12-year-old on a telehealth visit and how you got to get creative to keep that person engaged in that moment versus being in the office and kind of having things to touch and move around. So creativity is helping us as well. I think we're also, like Debbie mentioned, really trying to be mindful of who does need something different. And as much as we can provide, an in-person type service for someone that's really going to be the most effective with, we're trying to get back to that now while everybody's masked and gloved and, staying, keeping 6 feet apart and figuring those things out too. Because we know that, it's not one size fits all for mental health care.
And my hope is that people will be more comfortable talking about mental health issues and reaching out for help because we are seeing more of that, through social media and people hopefully reaching out and asking for support from family or friends because we all are struggling in some way, whether we admit it or not. It's different for all of us and we have to adjust to those changes. So my hope is that this will help reduce stigma behind substance abuse and mental health and make people more comfortable getting the help that they need and talking.
And right now is right now is a really good time to reach out for help if you're one of those folks that's a little more nervous about, what's it going to be like walking into this building or what it's going to be like, who's going to see me in the lobby. We hope one day that none of that exists and everybody just feels comfortable to walk in and get the help they need, just like they would if they broke their leg. But for the fact that right now you can pick up a phone and set up services and never have to even walk into a building is, a really amazing opportunity for some folks. So for those people, I hope that they also take advantage of how we're able to do telehealth and access care right now.
Mm-hmm.
Well, yes, thank you. Thank you so much. And I completely agree that hopefully the goal of something like this event tonight is to open that door and encourage people to reach out to you all, or to maybe, even if they never reach out, to think about their own mental health in a different way, or look at opportunities to maybe just be more cognizant of those around them, their loved ones, their family members, their coworkers, if you will. So with that, no additional questions have come in, but I want to thank you all again. If there's anything additional you'd like to say before we wrap up, I want to give you that opportunity. So
I think I would just like to say, in the bigger picture of this, if we think about like the history of humankind, people are resilient. The human spirit is alive and well, and people of many different cultures have overcome many different challenges, you know, whether it's another pandemic, whether it was wars, whether it was, you know, all kinds of awful things. And maybe it wasn't our generation, but those generations made it through, you know, and they found new strength and they found maybe new ways of doing things, you know. And so if we believe that we don't lose that from generation to generation, you know, we all have that capability to make something better out of this. And whether it is a new way to reconnect with people and understanding of how important it is that we connect with our loved ones, there can, you know, I believe that there can be a silver lining. You know, it doesn't mean we don't have to go through the hard stuff, and we do have to go through the hard stuff, and it's important to follow the health recommendations and everything, but I really believe in the triumph of the human spirit. And that, you know, and why we're here is we want those people that are not feeling triumphant in their human spirit to feel like that they can reach out if they need to.
Debbie, speaking of that, do you found that people have learned more about themselves during this time in that regard, to be more resilient and to persevere?
Well, I'll let my other folks talk, but I think absolutely. I mean, the fact that there's things like there's all kinds of free mindfulness things being used, and you know, that people are self-organizing in different places in the state and the country. They're starting to connect with their neighbors, and you know, I've read in 2 different places where one was in Italy and one was in Springfield, Virginia, where people were dressing up in outfits and walking through their neighborhood every day just to make their neighbors have a smile on their face. So I just think that, I do think that's happening, but we also don't want to leave behind the people that are kind of isolating and not doing any of that. So what, Tamara, Sheila, what do you have to say?
I was just going to say, I think we realize what's important in life. I know for myself, you know, just self-reflecting and really what's important when all those things that we can't do and connect with that we normally have been, just kind of weeding out the important things. And I think I've seen my neighbors more in the last 3 months on the, you know, walking up and down the neighborhood than I have since we moved in here. So just seeing people out and being able to wave from a distance, connect that way.
Yeah, I agree. I think there's some growth in it. You know, I think some folks are also appreciative of the slowdown. You know, we live in a world that's so rushed all the time, and there's another thing to do, and just having some extra time to be, you know, self-reflective, like was said already, or you know, be more mindful, or if you're spiritual, be more spiritual, or spend more time with family if there's a family you care about in your home. I think those are the little things that people are embracing right now.
And speaking of gratitude, we talk about this, a couple of us periodically at where we work, and that is, we're like, can you imagine if this had happened like 15 years ago, when the technology wasn't there to connect with people, when, you know, social media wasn't there, where grocery store pickup wasn't available, all those kinds of things that are now, or that you can have stuff delivered to your house, you know, in a couple days. Those kinds of things, really, if we're going to go through this, it's so much better now than going through it like they did back in 1918. So, so there are some real things to be grateful for the advances in technology and commerce that we enjoy now.
Mm-hmm.
Absolutely. Well, thank you once again, you know, in that spirit of gratitude. Thank you for providing this opportunity for us tonight, for using the technology to bring the information to all of us, as Tamara said, and for giving us the opportunity to sort of slow down and maybe pay attention to some of this stuff. So thank you all so much. I'd like to thank the county administrator and the Board of Supervisors for bringing this to us tonight and for giving us the opportunity to learn from you all. Debbie and Sheila and Tamara, thank you for everything that you've provided. Be sure to thank your staff for everything that they do for the community, and your board and any of your community partners. We're very thrilled that you all are here with us in the community and helping get through. So with that, thank you once again, and we will sign off.
Thank you.
Yeah.